Okay, so let's talk about herpes simplex encephalitis. So, herpes simplex encephalitis, it is usually herpes simplex virus type 1 that awake, let's call it, reactivate from the trigeminal ganglion. And you can also think about HSV6, HSV6 in immunocompromised patients. Now, it's quite dangerous disease. As you can see, most common cause of fatal sporadic fulminant necrotizing fatal viral encephalitis and its characteristic imaging findings. Two subtypes, we have neonatal herpes encephalitis in childhood. Now, the clinical symptoms are not specific. We are talking about fever, headache, and sometimes mental status changes, but when you see fever, mesial temporal lobe signal abnormality, and acute altered mental status, those three things should alert you for the suspicion of herpes encephalitis. It's very important because you need early treatment with antivirals like acyclovir to treat this condition that may be very dangerous. So you can see that it is usually mesial temporal lobe area, and you need a lumbar puncture for identification of HSV, which is still not 100% sensitive. And this is on a DWI. You see this restricted diffusion on the temporal lobe area. So again, temporal lobe area abnormality, signal abnormality with fever, especially with mental status change. This is not the only diagnosis, but think about herpes encephalitis. Now it causes edema, as you can see right over here. It can cause hemorrhage, necrosis. On CT, it may be normal, but there may be hypoattenuation area. Now, the T2 prolongation, as you can see here, may be in the medial temporal lobe, insular cortex, cingulate gyrus, and inferior frontal lobe. Now, there is a differential diagnosis, like MCA infarction, infiltrating glioma, limbic encephalitis, and seizure-related changes. But remember that in herpes encephalitis, we are talking about a patient with fever. Now, fever won't be in glioma usually and won't be in infarction. So think about herpes encephalitis in any patient with fever and signal abnormality in the medial temporal lobe. And that's it. Thank you very much.